Hi, my name is Christine. I'm going to be doing active range of motion at the elbow. So the different ranges that we're doing is flexion and extension, and that happens in the sagittal plane around the coronal axis, and then supination and pronation, which happens in the frontal plane around the sagittal axis. So, which is your injured arm?
This one.
Alright, so what I want you to do is, we're going to do flexion first, so bring your arms up to your shoulders.
Okay.
Any pain with that?
No.
No? Okay, so she has full range of motion for flexion. Now can you do extension, just like this?
Okay.
Pain with that?
Yeah.
Alright, where's your pain?
Right there.
And on a scale of 1 to 10, what is your pain?
Like a 6.
6? Okay. With that, I think that she has around 20 degrees difference for her extension, and it's less extension on her injured arm. Next, we're going to do pronation, so I just want you to have your arms like this, and we're going to put your hands towards the ground.
Okay.
Any pain with that?
No.
Okay, full range of motion, both arms. And supination. Any pain with that?
No.
No? Okay, and full range of motion again with both arms. So next I'm going to do goniometric measurement, and the fulcrum is going to be the lateral epicondyle. The stationary arm goes to the chromion, and the moving arm goes to the styloposis of the radius. So I'm going to get you to move your elbow, or you're going to do full flexion, and I will do the measurement once you get into flexion.
Okay.
There you go. Alright, so she has 136 degrees of flexion. Next I want you to do extension just to where, just as far as you can.
Okay. That's it.
Alright, and with that she has 30 degrees less extension than 0. So my indices of suspicion would be if there's a palpable defect, or also one that you can see on the tip of her elbow, I would assume that it's bursitis, just because she had pain with extension. Then she could also have posterior impingement syndrome. With that, she would have pain on the posterior medial side, and she would also feel like a clicking or a locking sensation with full ranges of motion. There might also be crepitus with that as well. And finally, I would suspect ulnar fracture. Often if there is something happening with the bursae, you have to rule out ulnar fracture as well. So with that, she would have pain on the ulnar side, and she would also have pain in all ranges of motion, just because there's muscles that would attach and cause it to shift and move, and that'd be painful. And that is my video.